Here we have Mrs. Jones in the waiting room. The therapist arrives and acknowledges the patient and introduces himself following the AIDET protocol. He then thanks the patient for completing her paperwork and continues by verifying her name and date of birth to ensure that he's working with the correct patient. They will now enter the treatment room. Now that the patient is seated, the therapist continues with a subjective. He asks the patient how they're doing and asks if their symptoms have progressed or worsened in any way. And he continues his AIDET by telling the patient the duration and the expected plan for the session. Mrs. Jones is in agreement with this plan. To start off this session, the therapist instructs Mrs. Jones on the completion of a tug, which is a timed up and go. This test consists of the patient rising from her chair, walking 10 feet, turning around, and coming back to sit down in the chair. The timer will start when the patient rises from the chair and will stop as the patient sits into the chair. Next, the therapist has the patient perform a 10-meter walk test. This test requires the patient to walk a distance of 10 meters, with only the middle 6 meters being timed by the therapist. With this test, we can calculate the patient's walking speed. To continue with the subjective measurements, the therapist will now complete handheld dynamometer testing to test the force the patient is able to produce during knee extension, as well as knee flexion. As we can see by these results, the patient is most limited on her right leg, which aligns as she has had a recent knee surgery. Next, the therapist obtains knee range of motion measurements through goniometry, specifically for knee flexion and knee extension. Again, it can be noted that the patient has limited range of motion on the right leg as compared to the left, which aligns with her recent knee surgery. As the therapist begins his treatment, he notes that the patient's range of motion on her right leg is limited, particularly with knee flexion and knee extension. In order to address this, he has the patient first complete passive knee extension range of motion with overpressure by putting her foot on a bolster and a weight over her knee. He then has her complete passive range of motion with use of a belt around her foot for knee extension. Upon walking in, the therapist observed the patient walking with decreased weight shifting. Therefore, he is working to address this deficit during his treatment by having the patient really focus on increasing her weight shift from left to right as she steps forward into each leg. Next, the therapist will teach the patient how to complete lateral step downs. This exercise was implemented as the patient demonstrates difficulty standing, coming to a full stand during the tug and just throughout the normal session. And she also demonstrates decreased strength when taking handheld dynamometry measurements of knee flexion and knee extension. For this activity, the patient should be holding onto the rail for safety and taking one leg down towards the floor, allowing the other knee to bend, and then rising back up to a full stance. This activity engages mostly the quad and the glutes if done correctly. Next, the therapist has the patient complete a set of hurdles. This is completed by having the patient step over a single hurdle with both legs before progressing to the next hurdle. This activity is completed to focus on improving balance and weight shifting, as this was again noted as a difficulty during her gait throughout the session. The last exercise of this session is a semi-squat. This should be done to a tall table or chair with a focus on improving glute and quad strength, as again, this was noted to be diminished during the sit to stands throughout the session, specifically during the tug. To complete this session, the therapist wants to ensure that the patient has something that they can work on at home. Here he will start to provide the patient with activities that he will then put on a handout to provide the patient with in order to complete at home on her own. The first exercise is a long arc quad. He first demonstrates and explains the technique for this exercise, and then has the patient return demonstrate to ensure that she fully understands the concepts and can complete with good technique. He further instructs that he would like her to use her third set to clinical fatigue. Clinical fatigue is defined as when the patient can no longer complete a full repetition to the best of their abilities. If she were to lose full range of motion or speed, this is an indication that she has reached clinical fatigue and the exercise should be stopped. The next exercise that's implemented in her home exercise plan is to continue with passive range of motion for knee flexion using the band and pulling that towards her chest. The therapist further instructs that this could be a belt from home, such as like one you would wear around your waist, or even something as simple as like a dog leash, whatever she would have available at the time. He also instructs that she continues to work on passive range of motion for knee extension by use of propping her heel on an item such as a bolster or a rolled up towel, or perhaps even a pillow. Again, whatever is available to the patient at the time. The last exercise that the therapist instructs the patient to continue for her home exercise program is a weight shift while holding on to a countertop surface with fingertips. This weight shift could be done as a progression into a single leg stance, but mostly just focusing on weight shifting left to right, again to focus on improving her gait, as she does not currently shift left to right, which makes her gait slower. To conclude this session, the therapist stops to talk with the patient to offer an opportunity for questions. The patient denies having any questions at this time, and the therapist then thanks the patient for their time and notes that he will print the HEP for them on their way out, and he looks forward to seeing them at the next visit.